all, can I say, we've just finished our National Cabinet meeting, and there will be a further Cabinet meeting on Sunday, on the weekend, and then back to Tuesday and Friday next week at this stage. The first thing to report is that we're seeing some statistics now that show that people are doing the right thing. In fact, we're very pleased with the vast majority of South Australians who are doing the right thing. We know that these restrictions that have been put in place put an extraordinarily heavy burden, especially on employees who have lost their jobs, but they are working, and we're seeing a massive reduction in the number of people that are coming to South Australia. Since we made our arrangements on Sunday to effectively close the borders, we're seeing a massive decrease in the number of people coming into South Australia. Of course, this is massively reducing the risk we have of further spread of the virus. We are taking into account that these measures that are being put into place are going to have a devastating effect on our economy. This is being noted at the National Cabinet level, and we will be having another Cabinet meeting on Sunday to consider other ways that we can help protect and insulate the economy in Australia, but also the people that are most adversely affected. Today at the National Cabinet we have agreed on a new set of restrictions, and this is especially regarding still to this day the highest cohort of new infections, which are people that are arriving back in Australia from overseas. So as of today, all people that come into, sorry, not as of today, as of tomorrow, all people that come into Australia will be required to isolate for 14 days, and this is no longer a self-isolation. This is a supervised isolation, and will occur in the city that they arrive. So if South Australians are coming back to Australia from overseas and they're coming back via Perth, well, they will be isolated, supervised for 14 days in Perth before they return to South Australia. If they arrive in Sydney, they will be in supervised isolation for 14 days in Sydney before they return to Australia. This was the principal new restriction that was decided today at the National Cabinet. As I said, there will be a further announcement following the Cabinet meeting on Sunday night if any other restrictions are put in place. I'm now going to hand over to Dr. Nicola Spurrier, our Chief Public Health Officer in South Australia, to give us a further update on the numbers for today.
Thank you. So we have had some more cases of COVID-19 reported in South Australia. 22 cases on yesterday's tally. So there's now a total of 257 cases. 9 of these cases are linked to the cruise ship, the Ruby Princess, and that takes the number of positive cases from that ship to 53 so far, up from 44 yesterday, and that's a total of 77 from cruise ships. It really is an example of when you have people in a close proximity of each other, how quickly these infections can spread. Along with the Ruby Princess investigation, my team have been provided with Virgin flight details which had departed Sydney on the Thursday the 19th of March. And we are asking anybody who was on that flight, and it's Virgin Flight VA428, who haven't been contacted already by CDCB to self-isolate. Now this flight is linked to passengers who had disembarked from a cruise ship. Virgin Australia and SAPOL have been trying very promptly to contact these people, but there's around 40 people who travelled on this flight who we haven't been able to get in touch with, and it's important that we are able to contact them. So the other thing to note is that our cases range in age from 10 years of age to the mid-70s. As you know, there was a young person who was, we were informed, was positive yesterday, and contact tracing is currently underway for this child. I'd just like to make it known that we were only able to make contact with that family late last night, and obviously we were trying the very best we could to get hold of them and also to make contact with their GP. And it did result in a slight delay in commencing our contact tracing, but it's obviously very important to get the history from that family first. There is also another 10-year-old today, so there's two 10-year-olds now. This 10-year-old is a close contact of a previously confirmed case, and this child has been in isolation and has not been at school whilst infectious, and so I won't be able to provide any further details about this, but because they were following the isolation advice, there will be no requirement for school closures. I'd like to make a mention of some of the clusters that we've had in South Australia, as I know people are quite concerned about this. The Lindop Hill and Barossa Chateau cluster has now risen to a positive 7 people. Again, I want to urge anybody that attended the facility on or following the 14th of March to self-isolate and to get tested if they have symptoms. Now, there was a wedding at that venue, and we are urgently trying to contact all of the guests that were at the Lindop Winery for the wedding. We've been provided with phone numbers from the bride and groom for a majority of guests, and we've been able to contact many of them. But if you haven't been contacted and you attended this wedding, I want you to urgently ring our information line so that we can get information to you, because you'll need to be in quarantine. Now, in terms of our hospital, I can give you an update about intensive care. Unfortunately, we do have more people requiring intensive care with COVID-19. There are 6 people in ICU at the Royal Adelaide Hospital, so an increase in 3 further admissions. And the additional cases who have been admitted to ICU, there is a 46-year-old woman, a 77-year-old man, and a 75-year-old man. And I would just like to please say to people that we are very sorry to hear of your relatives being admitted to ICU, and I'm personally wishing them a swift recovery. Of the 6 people, unfortunately 2 are in a critical condition, but the 4 remaining are fortunately stable. In terms of testing numbers, SA Pathology is continuing to do a sterling job. In total, there have been now more than 23,500 tests done in South Australia, and if you are following some of the data that's been reported on a number of the media sites, you will be aware that we're testing more people in South Australia per head of our population than any other state in Australia. I'd also like to note, as the Premier has talked about the new requirements for people returning from overseas, that we did indeed have an Air New Zealand flight arrive in our airport today. We have been very pleased to have SAPOL helping to monitor our borders, but of course having a larger international flight meant that we needed to increase our presence at the airport this morning, and that was to ensure appropriate social distancing for those passengers, and also so that we could provide detailed information to those people about their requirement for quarantine. So I'll stop my report now, but I'm happy to take questions.
Doctor, the comments from yesterday, you saying that there was a bit of an unfortunate hold-up in the notifying of the public between the young child, and I don't know if it's a male or female in the southeast. Are you saying there was a bit of a problem there?
Oh no, not at all. So when we get the test result through, it's either it's really the practitioner's responsibility who gets the test to obviously inform the parent or the patient, and that's obviously what we normally do in medicine. It's the responsibility of the person that ordered the test. However, because we have such a close relationship with SA Pathology, we do receive the test result. And because it's of such importance from a public health perspective, we also make contact with the family, and we couldn't get hold of the general practice at the time because of the time in the afternoon or late afternoon. We continued to contact the parents, and we were pleased to be able to make contact with them later. However, in that intervening period, because of course there could be implications for that school, our communicable disease team contacted the education department. They confirmed which school that child attended, and then we were able to put very quickly in place a school closure. Of course, if we'd waited to the next day, there might have been the possibility of other children attending, and we didn't want to take that risk. So no, it was very prompt. In fact, given that we couldn't get a hold of the parents, and of course that's through no fault of their own, sometimes mobile phone reception drops out in rural parts of the state, in other parts of the state, and not everybody's monitoring every phone call, but fortunately we were able to get hold of them later in the evening.
Dr. Spurrier, can I ask you two questions, please? The first thing is, can you detail which of the patients are in critical condition, please?
So I can't give you any more details because as is our health policy, we don't provide further details about people that are in our hospital system. But I think that this is really a very timely reminder to people. This is a nasty, nasty virus. Many people can be quite mildly symptomatic, particularly young children, but there are people in our community that are more vulnerable for whatever reason, and they get very sick. The fact that we have 6 people now in our intensive care absolutely should drum home to all of us that we need to be following all of the public health instructions around hygiene, around social distancing, and please try and only undertake essential travel.
Can you say if those 2 people though are among the new cases in the past 24 hours, or are they people who were previously in intensive care?
I don't have those details, I'm sorry.
Dr. Spurrier, can you just understand people's frustration that you say that the second 10-year-old case today wasn't infectious and wasn't at school? Is it not prudent to try and calm the school communities to say, X school, there is no problem, but we are aware of it, and so that the parents, rather than hearing it through rumour mill or other places, they can hear it straight from your mouth?
Look, I'll certainly take that on notice, but I haven't been provided with what the school, because what is important to my team is making sure we're providing public health advice to ensure the safety of the South Australian population. And I can assure you that this child had been in self-isolation, so had no contact with anyone during the infectious period. So there was no requirement, therefore, to close the school.
You highlighted before the importance of self-distancing and isolation. Are you satisfied that people in SA are heeding that message and that people are in fact isolating and self-distancing as much as they should be?
I'll also ask the Police Commissioner to comment on that, but I have to say at the beginning of this week, perhaps on Sunday when I was driving into work, I was somewhat perturbed at the number of people that were out and about, particularly I know that restaurants were providing takeaway, but we did feel that there were quite a number of people that were still coming together in these sort of larger social gatherings. But I have to say, towards the end of this week, I think people have heard the message about social distancing, but I think there is more that we can do in terms of reminding people.
What condition are the 2 10-year-olds in?
I've been told that they're in a stable condition, and as you're well aware, children often have very mild symptoms.
Dr.
Staff at
Spurrier,
the St Andrews private hospital have received an email about someone working there testing positive, and that they'd had contact with about 20 people and contact with 2 patients. Can you confirm this?
Yes, we do have a positive test result in a health worker at St Andrews, and I would like to say that St Andrews have been extremely helpful in helping us with following up all of the contact tracing, and so that was the reason for the St Andrews sending out that email. And we'll be working closely with them to ensure that anybody that has had close contact is informed, make sure that they haven't got any symptoms, and all of those people will be required to then go into quarantine.
How worrying is it that someone in a hospital has tested positive?
I think it is concerning, and you know, when you look at international studies about the high rates of our health staff that do become infected because of the fact that they're at the front, at the coalface, as it were, managing and treating patients. So it is concerning, but in terms of the risk to the public, we will be doing the contact tracing and making sure that others around who have been exposed are now put into quarantine.
Is this person a doctor or nurse?
Look, I really can't provide that information because of the privacy issues, but I can confirm that they're a healthcare worker.
Are there any other healthcare workers in the latest cases?
No, there's not.
Can we ask the Commissioner to give his update now, then we can go to some more broad general questions? Sure. Commissioner? Commissioner, who is also, of course, the state coordinator during this major emergency declaration.
Thanks, Premier. Just as a brief introduction, we're continuing to check compliance by people who are required to self-isolate, and we're also undertaking checks on businesses that are required to be in some form of closure. Overwhelmingly, we are seeing levels of compliance. We are at this point in time encouraging people that we speak to continue their quarantine practices, and those premises that we found that are not complying have been given instructions and are complying immediately after those instructions. From a workforce point of view, South Australia Police, like every other aspect of the community, has staff who are in quarantine. At this point in time, we have about 122 police staff who are in self-quarantine. We've had 18 of those people tested for COVID-19, and we're still waiting for results on 6. One staff member has returned a positive test, and I think this goes to the heart of why we're asking people to self-quarantine. That officer was overseas on travel, returned home and went into self-quarantine immediately and has had no contact with the remainder of the workforce, which means it hasn't had any further damaging impact on our capability to deliver services to the community.
Commissioner, how many penalties have you issued?
At this point in time, we've issued no penalties. We're taking an approach where we are consulting with the community. We're dealing with people who are not ordinarily coming into contact with police, and we think there has been a slow take-up in terms of people's appreciation of the seriousness of this. But we are changing our posture now. We are now increasing the number of checks that we do, and in the very short term, we'll be instituting a more enforcement-based approach.
What will be the penalty? Have you got a penalty set?
We have advice that's being prepared and is going to Cabinet tomorrow. So
there's no, you can't give someone a penalty because there isn't one.
Yes, there is. A failure to comply with the direction under the Emergency Management Act can attract a penalty of up to $20,000 for an individual and up to $75,000 for a body corporate. That would require a prosecution to be initiated through a court process, and we're providing advice to Cabinet about streamlining
so
that process.
You're reasoning your way into this because you're saying that you're issuing people cautions who have clearly disobeyed the law.
That's correct. But this is a new and challenging environment for everybody.
You've got to hit it hard, don't you?
We are about to lift the level of enforcement capability and also the number of checks that we're doing, because we believe this is a point in time now where there's been enough warnings, there's been enough education provided, enough information, and people should have a clear understanding of their obligations when they're in self-quarantine, and we'll be holding people accountable for that.
Can you issue
Commissioner,
any
can I ask,
fines at the moment? Can you issue any on-the-spot fines?
No, the current process requires us to initiate a court prosecution, but we are providing advice to Cabinet tomorrow that will look at a streamlined process.
Can you tell us how many checks you've actually done?
At this point in time, I don't have that information, but we will be providing more information about the full status of checking tomorrow.
How
Okay.
welcome is the army help that you'll be getting?
At this point in time, whilst it's appreciated that the offer's been made, we don't require that level of assistance, but we are keeping that, I suppose, in our back pocket in the event that the checking regime requires further resources and the police resources in the state are not able to deal with that, then we'll certainly look at that as a consideration.
Are
It's not something we're thinking about.
People dobbing in neighbours and friends?
Yes, we are receiving calls. We've opened up our 131 444 and Crime Stoppers numbers for people to provide information to police. That information is being checked against health records as well as the records we're now obtaining from people entering the state through border checkpoints or by air, and we're making an assessment as to the need to follow that up. There have been several calls to those lines.
What area of SAPOL is this infected worker based in, Commissioner?
He's in an operational policing role, but as I said, this officer has had no contact with the workforce since returning from overseas. This officer followed the instructions and self-quarantined immediately, and that's prevented any further exposure to our workforce.
What operational part of SAPOL?
We wouldn't disclose that. It's not relevant.
So when would you expect penalties, if any, are to be issued? I know you're saying it's going to Cabinet, so does that start straight away?
Once it's passed through Cabinet, well, firstly, we can initiate action now if we see a serious breach that warrants a prosecution to be initiated. But I'm confident that we'll be able to streamline that process quite quickly, and you'll see a different posture moving forward in the very near future.
Have you seen any serious breaches?
At this point in time, particularly with businesses, we've had some businesses that seem to have completely misunderstood or disregarded the instructions. We have moved in and given specific directions which have been complied with immediately.
Repeat offenders?
At this point in time, no repeat offenders.
What kinds of things? What have they done?
Simply allowing too many people in their premises, being a premise that or a business that has been required to ceased trading, but continuing to trade, and we've moved in swiftly. There have been significant numbers of business checks, and where we have found non-compliance, we've found that our intervention has caused compliance immediately.
Commissioner, were you involved in this case of the 2 US tourists that fled the state before their tests came back?
That was not something that involved the South Australia Police. In the first instance, those people were tested for COVID-19 and left the state prior to the test results being known. Their destination was advised of the fact that they were heading that way, but it is now something that's been considered by police in terms of any offences that were committed.
So can I just follow up with that? You're actually investigating this couple for what they've done with the potential idea of laying charges?
I won't extend to speculating what might occur, but we are certainly having a look at that particular incident.
Premier, can we ask you a few questions? Just on the hotel quarantine, where will that quarantine, where will it be, what location?
Well, it will be the hotel supervised quarantine will take place at the port where people come back in, or the airport where people come back in. So there is a cruise ship which is off the coast of Western Australia. That will of course mean that South Australians on board that will be quarantined in Perth. And any international flights that come into Sydney, Melbourne, Brisbane, they'll be quarantined there. As we pointed out earlier, there are no further scheduled international flights into South Australia, so we won't be participating in that part of the restriction. But more than that, we don't have any cruise ships which will be docking here in South Australia. So although we signed up to this national approach, South Australians that are returning will actually be in their forced isolation. There's supervised isolation in other states, not South Australia.
And
Premier, can you establish how close are we to a total lockdown? I know that you and the Prime Minister have said people are starting to behave themselves, but is there going to be a lockdown in South Australia? Is that inevitable?
Look, we've already got very strict restrictions that are in place. The AHPPC advice is no further restrictions over and above what was announced today. But look, I think people should be prepared that there could be further restrictions into the future. But this will be made on the advice of the AHPPC and addressed at the National Cabinet.
Wouldn't it make sense, or wouldn't it be prudent to have lockdowns in, Dr. Spurrier's spoken about clusters, that you can identify an area and just say, bang, lock that down for starters?
Look, we are receiving expert advice virtually, around the clock at the moment via the AHPPC. If they make the recommendation, that will be put into place straight away. They're satisfied with the restrictions that have been rolled out and increased in the last 2 weeks. A very significant further increase today, dealing with probably the single most important risk, which is people returning from overseas. So a very heavy restriction. Now, of course, most of that which affects South Australians will occur interstate, but we're very happy for this further restriction to be put in place.
Premier, could you see a time the convention centre would be used at all?
No. Look, we've done all of our planning, and we've got our sites that we believe would be necessary in all different scenarios. So I'm not going to talk about individual sites, but please be assured that this is a plan which has been in place for a long period of time and is now being progressively rolled out.
Premier, can I ask you your opinion on the US tourist that the Commissioner now says is the subject of a police investigation, fleeing the state, doing the irresponsible thing? And also, are you concerned that international flights are still arriving in Australia despite your concerns?
I think we've got an obligation for Australian citizens that are overseas to return. I think we've got a constitutional responsibility to return those citizens and allow them to come back into Australia. Of course, there are no people coming from overseas that aren't Australians anymore, but now very strict supervised supervision, quarantine for 14 days for all Australians returning back to this country. But let's be very clear, that tap is virtually turned off. There are very few flights now coming back into Australia, and no further international flights coming into South Australia whatsoever.
Given the higher cases interstate, would you see a need to extend that forced hotel quarantine to interstate travellers coming into South Australia?
Look, we'll look at all issues and suggestions that are put to us, but at this stage that hasn't been a consideration. Let's be clear, people that are coming from interstate to South Australia since the announcement on Sunday, and certainly since the borders were manned as of 4 o'clock on Tuesday. They're now required to sign a declaration committing to 14 days of self-isolation, nominating where they're going to be, and then being the subject of a SAPOL check, a random check. So there are already very significant restrictions. We've gone from a massive number of people coming into South Australia just 2 weeks ago, and we've really turned that tap off, and that is really going to be a very necessary restriction to make sure that we can control the further spread of this virus.
For those
Can I
South
just ask you,
Australians who
sorry,
are coming
the
in,
US
for those South Australians who are flying back to Australia from overseas, and then say they fly into New South Wales, have to do a 2-week quarantine period, given that we've also imposed in this state a 2-week quarantine period, will they, upon returning to SA, have to do another 2 weeks?
Well, because this isn't coming into effect until tomorrow night, that's something that we're considering. But yes, prima facie, they're going to have to do 28 days isolation because, of course, they might be cleared of the infection when they arrive in Sydney, but then, of course, they could actually catch the virus whilst they're still in Sydney, making their way back to South Australia. There may be some ways that we can work around it with Victoria, for example, if they are loaded straight onto a bus that comes straight across, but I think this would be implausible from New South Wales. But we've worked through all of those issues. Don't forget, this announcement was only made a couple of hours ago. We're working through those implications. But any person coming from interstate is required to do 14 days, and now we've got a new restriction. People coming from overseas will do that isolation supervised in the city in which they arrive.
Premier, can I get your opinion on the US tourists that fled the state?
It's disgraceful behaviour for two US citizens who were here on holidays to actually depart the state before they knew the results of this test. They put the lives of other Australians in jeopardy. It's disgraceful behaviour, and it's something that SAPOL is now following up.
What's the
Premier, do you
government,
want
what's
to
the government doing to
quarantine,
support families learning from home who can't afford laptops and
Say that again,
computers?
sorry?
What's the government doing to support families learning from home who can't afford laptops or computers?
Yeah, look, we're in the midst of a massive change with our schools as we move to predominantly students being educated at school, to a large cohort now going to be learning from home. This is one of the reasons why the 4 days leading up to Easter will be pupil-free days, so we can get all of these arrangements in place. I'm very happy with the progress that the department and the government is making with regards to the provision of those educational materials so that they can be ready in term 2. And they are going to be a combination between screen resources, which will be difficult for some families, and hard copies. We're taking all of these things into account, and I'm very happy and satisfied with the progress that's being made under enormous pressure in a very, very short time.
Premier, do you support closing Kangaroo Island?
I think that is something that we're going to have to look at. I'm certainly of the opinion that all non-essential travel needs to be at an absolute minimum, and
The Mayor doesn't.
Sorry?
Well, the Mayor seems to think it's should be staying open to...
Well, you asked me my opinion on this. I think it's very clear that all non-essential travel of any sort, quite frankly now, is something that we should be avoiding.
Premier, those 4 days leading up to Easter, will all schools be completely shut down? What about those students?
What we're doing is having pupil-free days, but we're making it clear on the AHPPC advice that schools should remain open, but there would only be a supervisory capacity at the schools rather than an education capacity at the schools during those 4 days which are pupil-free, and that will then extend to the school holidays. But it really means students that are going to school during those 4 days will really only be getting the same sort of access to sort of what would be available online, rather than a teacher teaching them during those hours at school. And I think, again, that the arrangement that we've entered into in South Australia is the best in the country. It recognises this balance that we've got to have with regards to the health imperative, but also the education imperative, and I think we've got the balance right in South Australia.
Premier, can we, the statistics that are coming out in terms of the number of cases every day, they're fluctuating somewhat, but they seem to be quite significantly lower than in the past couple of days. Is there anything that we can read into that? Are we starting to get on top of this?
Look, I think, quite frankly, reading too much into the number of notifications on a daily basis, whilst it is one indicator that people have got and they can recognise on a daily basis, they're going to bump around a bit. I mean, they're being massively skewed because of the number of people that have come back and been infected, both directly and indirectly from the Ruby Princess, and I think we'll see that flush through the system. I think we'll see the number of international cases flush through the system, and ultimately, because of the decision that we made on Sunday, I think you'll see the number of interstate transmissions or transmissions based upon interstate travel reduce as well. So I think what we're doing in South Australia is looking at all the risk areas and putting restrictions in place as quickly as possible to bring that down. But I think that we are likely to see a movement around for the next couple of weeks, and hopefully after that they will stabilise. But look, we're in the midst of a global pandemic. The issue that we're trying to do here in South Australia is to reduce that peak and push it out as far into the future as possible. There is no plausible concept that we can eliminate this virus in South Australia and lock down and basically wait for a vaccine in 12 months, 18 months' time. The reality is what we've got to do is to put restrictions in place so that we can reduce that peak, push it as far into the future as possible, build up our medical resources and capacity so that we can handle the volume that is likely to come our way. And quite frankly, I think every South Australian should feel very assured that we've got excellent public health administration in South Australia, excellent health facilities, and people that have been thinking through these various scenarios now, not for the last couple of days or weeks, but months. And that is really putting South Australia in a very good position compared to just about any other place in the world. And the restrictions that we put in place on Sunday are really, really important. And I know that they can be devastating for some businesses, but they're really, really important. Because if we can get further behind the front, both internationally and in terms of the eastern states, and we put ourselves in a much better position to learn from those other jurisdictions, understand what different types of treatments are available to make sure that people who are infected get through it in a better methodology. And of course, every day we are getting closer to a vaccine.
Premier,
Last
Economist
question,
John
we're going to
Spurrier
go.
says that within 2 months we could see South Australia's unemployment rate double. How concerning is that?
But we're very, very, very concerned about the impacts of our restrictions on employment and on small business and larger businesses in South Australia. And that's why we've been very quick to move with $1 billion worth of stimulus and support. And look, let's be clear, there's going to have to be more from both the state and the federal levels. It's one of the things that we'll be considering again at the National Cabinet meeting on Sunday.
Commissioner, can we just ask you one quick question? Your advice to Cabinet, is that going to include on-the-spot fines that you're wanting to issue on-the-spot fines, and how much will they be?
Well, I won't elaborate on what we're putting to Cabinet. There's a process that we should respect, but as I said, there'll be more information available about that tomorrow.
But you are talking about on-the-spot fines rather than
We're
prosecutions?
talking about streamlining the prosecution process so we can deal with people more quickly.
So not on-the-spot fines?
As I said, we'll talk about that tomorrow. Thanks.
Thank you.
We've got to all get going. Thanks.